And welcome back to Fox 59 this morning. And starting this month, some people on Medicare may be eligible for certain weight loss medications through the new GLP-1 Bridge program. But before you head to your doctor, there are some rules about who can actually qualify. And joining me this morning to share more on who can join the program and how this program works is Dr. Kudo Anakwute from Dreamland Health and Wellness. Dr. Anakwute, thank you for joining us this morning.
So
it's good to see you. It's been a while.
Yes, it has.
Let's talk about the changes to the rules. May be confusing for some people.
Yes.
Who is eligible for this program?
Yes, so this is a pilot program. And the first thing is that the patient has to have a Medicare Part D plan. And there are some clinical medical requirements that are needed. So the Medicare Part D plan is in place. And then the patients have to have a BMI of greater than 35 without any additional diagnosis.
Wow.
Or they can have a BMI 30 and above with some clinical diagnosis as well. Now they can either have chronic kidney disease, heart failure with preserved ejection fraction. They can also have BMI above 27 with some other medical problems, and this could include prediabetes, could include a previous stroke, could also include previous heart attack and symptomatic peripheral artery disease. Now, patients who already have sleep apnea or diabetes may not qualify.
Wow, so it is important for you to go see a
Yes.
physician to find out if you actually qualify. How have these changes basically in Medicare affect the people who may qualify?
So this is great because before now, Medicare has only covered these GLP medications like Zepbound and Fondayo for people who have diseases like diabetes.
Correct.
And heart diseases, but not obesity standalone. And so that gives access to a lot more people who have been waiting because of cost to get these medications.
Wow. Let's explain to people, how do these weight loss drugs work?
So most of these meds work by reducing appetite, and that is one great thing. They do work best, however, when it's combined with lifestyle changes such as...
That's the key.
Yes.
You just can't take the drug and just
Exactly.
continue to do what you do. You have to change some things.
Yes, definitely. So you want to make sure that you're getting good diet, you're taking lots of protein, and you want to increase activity as well, improve on your resistance training, because as you lose weight with these medications, you want to make sure that you're retaining your muscle mass.
Yeah, and that muscle mass is important because
Yes.
you lose it, you literally can't walk.
Exactly.
So when patients come to you about weight loss drugs, what are some of their questions? What are they asking? And you know, a lot of it, I'm pretty sure and assuming that it has something to do about changing the way they look.
Yes, absolutely.
And feel.
Yes, so I get a lot of questions and side effects. I also get a lot of questions on what if when I lose weight and I no longer have access to these medications, will I regain the weight? Those are the kind of questions that I get. Just as these medications, these medications also have side effects. And so making sure that you're being monitored is definitely crucial, to watch for those side effects and know when to stop or when to decrease the dose as the case is.
And finally, if you are on a weight loss drug, why is it important to have a plan in place?
Yes, definitely. For example, this program is a pilot program. It is temporary. We're thinking it's going to last for about 18 months. And so we don't know if it's going to continue. That means that the access could be lost. And so making sure that you have a plan, you have that diet and lifestyle, and so that if you lose access to these medications, then you can maintain your weight loss by your lifestyle. Yeah. So having a plan in place is definitely crucial. Yeah.
Dr. Anakwute, it's always good to have you on our program to talk about anything health related. You're so versed in it and knowledgeable, and we appreciate it.
Thank
and
you.
helping us and guiding me and our viewers through it. So we appreciate you being here. It is 9:45 right now. Meteorologist Jim O'Brien. You know, this heat,
oh my God.
It can affect a lot of people. Jim is here with our forecast.
Hey, no doubt.